So welcome again. Today we're going to do our joint class. We've got lots of folks here. There's going to be more folks coming. This is a little bit about us and our hospital. But this is what we're going to go over today. We're going to go over your surgery. We're going to go over what to expect, what to do before, what to do during, what to do after. You're going to get to meet some folks. You're going to learn about your bill. You're going to learn about the anesthesia. All these things. So lots of things for you today. Here's some members of your team. There's going to be some members of your team that aren't here that you're going to meet later once you're in the hospital. Here's a little bit of everyone. This is kind of who we encompass. Your dentist, I think, is the only one not on here that you will probably see also before surgery. Okay, so you've got your surgeon. What are you doing? What surgery are you having?
I have my right hip in 11 days.
Okay, so you're going to see Dr. Jonason.
Yeah.
All right, great. You have probably seen your primary care physician already. You're going to meet with anesthesia today. You're going to meet with your preoperative nurses. You're going to meet with med-surg. They're going to be here today. The surgical team, a little bit of everyone, and then people here while you're in the hospital to get you all taken care of, get you on the road to recovery. All right, so the first thing, it starts with you. It starts with your motivation. It starts with, your kind of willingness to help us. We're here as a resource, but you're kind of the driver, okay? So by your positive attitude and your preparation, you're going to contribute to this successful surgery, okay, and get you doing well quickly. All right. All right, so you probably received last time one of our booklets. Go through that booklet. That's going to kind of give you a timeline. Some of those timelines are pretty important as far as when to do things, because some things can be done too early or too late that are going to affect your surgery. So make sure you kind of jot those times down when you should get labs drawn or when you need to see certain providers, okay? And that book also will help answer a lot of questions. It answers questions about if you're taking different herbal supplements, what to kind of do at home to prepare, and that kind of thing. So it's a great reference, so make sure you read through that. Make a list of questions to ask also. And then, we're going to be your resource here today, but obviously Dr. Jonason's office will be a great resource for you too, if you do have questions later after you've read the book and that kind of thing, okay, before surgery.
My name is Jenny. I'm with Patient Financial Services in registration. So today we're going to talk, Kenneth, a little bit about what to expect with registration and billing. So first and foremost, with registration, it's nice to go downstairs and meet with somebody like myself, a registrar, so we can sit down together and talk about what your insurance is, whether or not it requires prior authorization. Here at the hospital, we're required to obtain that information for you so you don't have to worry about it. With the registration process, we're also going to get you set up and take care of all those fine details for the billing side of it. So if you don't have time today and you want to do some registration.
And I did a few days ago.
That's fantastic. If you didn't have time to do it and you had other questions, this little handout right here has our phone number on it where you can call and talk to an educated registrar.
Sure.
And ask further questions. Now, the second thing I want to talk to you about is about this little understanding your hospital bill. This brochure is just a nutshell on the billing process. The main thing you need to know about in here is a few of the numbers. So when you open it up in here, we've got a few of the commonly listed numbers. There are multiple people who will be billing for your services, such as Monarch Anesthesia, Dr. Jonason, as well as Heart of the Rockies Regional Medical Center. So you could see up to 3 different facilities billing for that data service for those services that are going to be rendered. Now, at any point in time, if you have any questions regarding medical billing or anything like that, on the very back page where there's a little piggy, there's a number where you can talk to a financial representative to set up payments or ask questions about how much your procedure is going to cost. The idea between registration and billing is that you just come in and have your procedure and you don't worry about the nuts and bolts. We take care of that for you.
Okay. And one more billing question.
Sure.
I know I have to pick my own rehab facility, and I can shop around. being on the program here, would it be an advantage to go to your Heart of the Rockies facility? Or are they going to be a similar priced? Will I save money by staying in the hospital system?
I can't answer that for you. That is going to have to be your educated decision. We can provide you with the options, and you'll be able to make whatever you feel is comfortable, not only financially, but for your well-being as well.
Right.
So, yeah, we'll give you the tools, and then you can make that decision. Anything
And I
else?
have to shop around on my own on that pretty much?
Yes, sir.
No, that's right. And
Yeah,
I'm
we
Dr.
cannot,
Starkey.
yeah, we can't
No,
influence
that's
you in
fine,
any
that's
way. We
fine.
just want to give you the tools.
Great, thanks.
Is there anything else I can help you with?
No?
All right, well, thank you. I'm going to turn it over to the next presenter.
Great. No,
Thanks.
good job.
Okay, I'm Mary Ellen, going to talk to you about bugs, germs, bacteria, all these little creepy crawly things. What our intent is today to try and help you get rid of a lot of those bugs that live on your skin. Bugs in our system, whether they're in our gut, on our skin, in our mucous membranes, outnumber our own body cells about 10 to 1. So you're already going in at a deficit, but we're going to try and take care of that. So before surgery, if you're having a hip or a knee, we don't want you to shave or wax your legs for about 3 days prior to, because we don't want any nicks in the skin. So if you're doing that, don't do that. You're not having a shoulder done, so we don't have to talk about the face or neck, but it's the nicks that can happen in the skin that we don't want you to do that, so you have a chance to heal up before then. Your mouth and teeth are a real common source of bacteria. Unfortunately, our mouth is one of the dirtiest parts of our body, and a human bite is almost as bad as a cat bite. So we want you to see your dentist prior to surgery and have your teeth cleaned. And if after your surgery, we want you to take an antibiotic prior to having any dental work done for at least 2 years after that joint replacement. So you're going to take, it would be just a one-time antibiotic about an hour before your procedure, and it's going to be a little more powerful than an antibiotic you would have to take for 5 to 10 days. So it's going to be a little bigger pill, but we definitely want you to do that. So, because like I said, those bacteria in your mouth, and when they clean teeth, they usually nick your gums, they can bleed, and that blood is a perfect source to take a bug right to that joint. If for some reason they love implants, and they'll go right to that joint, and we don't want to have to take that joint back out. We want you to be able to keep that joint. So bathing, if you haven't already, have you received your...
I have not.
Okay, you should be getting these in the mail, and you'll be getting 2 packages, and we want you to use them starting 2 nights before surgery. You can take a tub or a shower, a tub bath or a shower. Either one is preferable. Towel dry, and then let your skin cool off for about 30 minutes to an hour. So you can just put on a bathrobe and let that skin cool down. Then we want you to use the wipes. And in that booklet that you received, that 3-ring binder, is this same little map of the man. So number 1 is going to be used on your chest and your belly. 2 are on your front and back of the arms. 3 is the front and back of your legs. 4 is your back. And these cloths are good size, so you could be able to even, do the little shimmy.
Two applications?
For 2, yeah, each night you're going to use, and one of these, each packet has 2 cloths in it. So you'll use all 6 cloths each night, okay? So, and then like I said, that 5th one is for the front of the groin area, and the 6th is for your bottom. Now, with these cloths, you do not want to scrub your skin. They're just something that you wipe on your skin. So don't rub, because we don't want you to irritate your skin, and vigorous rubbing can irritate the skin. So we just want to put a coating of this antimicrobial substance on your skin, and it's going to dry and start killing some of the bacteria on your skin that we don't want. So it's going to kill the bad stuff. Don't put them in the microwave, because they can overheat and get hot spots in them, and you can get a burn.
Should I start with clean sheets 2 days before?
Yes, as when you do that, when you start your prep, clean sheets.
Clean sheets?
Yes.
Clean towels?
Clean pajamas.
All clothes that have been washed? Okay.
Yep, I'll close it, so you're going to put that on. And then that morning of surgery, Andra and her crew are going to give you another packet of 3 cloths, and you're going to do the very same thing that morning of surgery. So, and if you need help with your back, they can certainly help you with your back.
I go every day to the hot springs and it's soaked in the 90-degree water. Is that going to wash this away? Is that still all right?
Sure.
Because I'll put this on at night, and then in the morning, it'll just...
No, but it has a persistence in it, so
Okay.
So you're not going to wash it off again. So, and the nasal screening, you're going to need to do this about the same time you have your blood work drawn, about 5 to 7 days out. And there.
I had my blood just 2 days ago.
Okay, you're going to have another set of blood work drawn for a type and screen, because that can't be more than 7 days prior to your surgery. So did they do your nasal swab at the same time?
They did not.
Okay, so when you come back in for that type and screen, they're going to swab your nose. And this is just barely, looks long like they're going clear into your brain with it, but trust me, they're just going to go inside your each nostril with this Q-tip, and then what we're looking for is a bacteria called methicillin-resistant Staphylococcus aureus. Big long word, MRSA. It's been in the news. So we just want to try and make sure you're not a carrier of that. Obviously, you're well, so you don't have any infection, but people can be asymptomatic or what we call colonized, and so they have no sign of infection, but that organism is living in their nose. And that's one of the most common, staph is one of the most common bacteria that we see in wound infections. So we want to try and wipe that out. So if that comes back positive, the doctor's going to order an ointment for your nose.
Yes.
And we'll be able to start that 5 days prior to surgery. And if you haven't had the medicine for 5 days before surgery, bring it with you, and we'll continue it while you're in the hospital. We won't have to cancel your surgery if you've only had 2 days of that ointment in your nose. We'll be able to finish it while you're here.
And for that reason, I should get my blood test exactly 7 days before.
Or you could do it 6. I mean, because
That's
we're,
right, but
yeah.
It's got to be within 7 to 6
Right,
5. Well,
right,
don't
right.
come in the day before.
Yeah, don't do it the day before.
Gotcha.
Yeah,
Good
yeah.
nasal swab.
During your hospital stay, you're going to see people hopefully coming into your room, kind of washing their hands or wiping their hands, and that's because probably before they entered your room, you've applied some they have applied some hand sanitizer that just fell off. So, yeah, really, looks like a bird. So anyway, they'll be coming in rubbing their hands, and that's what you want to see. And if you haven't seen somebody sanitize their hands, feel free to ask them, did you sanitize your hands? Our skin is thick enough we can handle that question. And at home, if you're doing anything around your wound, wash your hands prior. Soap and water is great, or if you have some alcohol. Hand sanitizer, you can use that, but you don't have to go out and buy sanitizer. Soap and water is fine. Pets, you want to try, usually with a hip, you usually have clothing on, so they're not going to be able to really have access to it to lick it like they might a knee if you're wearing shorts. But keep the pets out of your bed, keep the pets from licking your wound. And you're going to need to know the signs and symptoms of an infection. Redness, warm or hot to the touch, increased pain, swelling, fever, or drainage. And it doesn't matter if that drainage is clear or cloudy, you need to let somebody know that the wound is draining. And then if you're having any other symptoms, they'll say, that's probably okay, or we should look at it. But be sure and let somebody know if you're having any drainage, because obviously that means there's a little break in the incision, and that's a good portal of entry for any kind of bugs. Okay? And you can always call that supervisor number if you can't reach the doctor, and that number is also in your book.
When I finally get home on the 5th day or so, will I have bandages, or at that point will I come home?
Yes, you will still have a bandage on.
So
And then when you see the doctor,
And will I change
no,
myself? Okay.
you won't touch that dressing until you see the doctor.
These require me looking.
Right, no, this is, well, you're probably gonna feel it.
That's right. I
Yeah,
understand.
yeah, you're probably gonna know.
Prior to surgery, like Mary Ellen said, you're going to receive those cloths, okay? And in your booklet, there's going to be a paper. There's going to be a paper that says when you should shower, when you should use the cloths, okay? So just kind of follow that. And you can also put X's to show that you have done it. So you got your initial blood work done from your primary care provider yesterday.
That's a few days ago.
Okay, great. And then we are going to have you come in that 5 to 7 days for that nasal swab and the type and screen. Okay, and so they will have to take your blood again, but again, that can't be done. It has to be done in that 5 to 7 day window. So that's kind of why we have you come in twice. But we'll receive your labs from the doctor, and I'll kind of review those. Our nurse anesthetist will review those. Your doctor will obviously review those and make sure that you're in the best shape you can be before surgery. All right. We will call you. We are listed as an unknown caller, so be aware of that. Some people don't pick up our phone calls. And we'll go over a little bit of your health history. We'll obviously have the doctor's history that they have done for you, but we will ask you some questions about your allergies, ask you some questions about your the medications you take, that kind of thing, how you do with anesthesia, all those kind of questions. So if you can have a list of your current medications, it's good to have. Good to also bring to the hospital with you for when you get up to the medical surgical floor. All right, so the day before surgery, we are gonna kind of go over these again when we call you. We'll usually call about a week out. So about a week from surgery, be looking for our phone call, okay? So you're gonna have nothing to eat or drink after midnight. That means no hard candy, no gum, no ice chips, pretty much nothing past your lips but a toothbrush, okay? We'll go over your medications. If there's specific medications that we think you should take prior to surgery, we'll have you take those with a small sip of water in the morning.
Are hips generally done in the morning?
So Dr. Jonason does usually 2 cases a day. There will be like a morning case and an afternoon case.
Because if it was the afternoon case, would you have a little more leeway on the midnight? Is it the number of hours you're looking for?
It is.
More than
It is.
midnight?
It's 8 hours.
I'm hoping for morning, of course.
Yes, we all are.
That's right. But it could be 3.
It could be 3.
I got you.
So it's 8 hours for any solid food, okay?
Yes,
But we usually say 4 to 6 hours for clear liquid. That's anything you can see through, okay? So coffee, no creamer, apple juice, tea, anything that you can see through, okay? But we'll go over those again when we give you a call, when we find out your time and that kind of thing. All right, so the day of surgery, you're going to arrive. You're going to check in at the front desk. That's that window that you saw right when you come through the doors to your left. All right, they're going to give you a name band and send you over to our waiting room. There, we're going to take you in. We're going to go over a lot of those same questions. Again, this is for your safety and our safety, okay? So we want to know your allergies. We're going to make sure we're doing the right hip on the right person, the right day, all those things. You're going to visit with your preoperative nurse. You're going to visit with the nurse anesthetist. Dr. Jonason will come in. He'll sign your hip, saying that we're doing the right hip, we're doing the right thing, okay? We'll take your vital signs, make sure that everything looks good. I do want to say we had a little bit of a kind of cold and flu season right before Christmas. So if prior to surgery, if you are feeling sick, make sure to let us know prior to surgery. Because again, this is a big surgery, so we don't want you going in and under the weather. We want you to have the best outcome possible, and so you being in the best health you can be prior to surgery is going to have the better outcome, okay? Any questions on what happens the day of surgery? Actually, right before surgery. We'll start there.
Is someone else going to deal with my Coumadin concerns? Because at what point will I be told when to go off
Okay.
Coumadin?
Yeah, your primary care provider, you saw them recently?
I'm going to, on Monday.
Oh, on Monday. Okay, he's gonna, he or she will talk to you about what they want you to do.
Yes, that's right.
That's a good question, though. Yeah, they'll get you on the right thing to do.
And I can drive myself and just leave my car here in the park. I don't need to have anybody with me.
No, nope.
But on discharge, I'll need someone.
On discharge,
with
you'll
me.
need someone.
But when I come in, I can just leave my car here.
Yeah.
And I won't be ticketed.
No.
Set out. Okay.
Yep.
Thank you.
No problem.
Well, thank you for coming. My name is Janelle. I'm a nurse anesthetist. I'm one of 4 of the anesthesia providers that you might meet on the day of your surgery. So I may be biased, but I think anesthesia is a huge part of having surgery. And it seems, in my opinion, that a lot of patients feel a lot of anxiety related to anesthesia. So that's what I'm here to do today, is to talk to you a little bit about what you might expect the day of your surgery and how we handle pain both for your surgery and pain after your surgery. So a lot of us all throughout the hospital are going to be asking you about your pain. We use a numerical kind of scale to help you describe your pain to us. 1 being, I'm in no pain, or 10, that is the worst pain I've ever felt. I can't take it anymore. So usually, this is a big surgery. We can't say you're going to be pain-free the entire time, but what we want is to find a goal that's reasonable for you. Everybody's ability to deal with pain is different. So what I might, one pain might not be okay for me, but we do try to find something that where you're able to rest, you're able to eat, you're able to relax and work with physical therapy. That's our goal for your comfort. So these are some of the things that, we talk about pain and how to describe it. Is it sharp? Is it dull? Stabbing, shooting, burning, crushing pins and needles? Those, just kind of having a description really helps us know how to target your pain later. So these are some of the descriptions that you might hear us refer to. Kind of talked a little bit about that, more about how to describe your pain and where it's located. All right. So we handle pain at Heart of the Rockies in a multimodal way, and what that means is we try to target pain on all kinds of different receptors and levels to keep you comfortable, and that's how we find that most people do the best. So one of the first things that will happen is, unless there's allergies or a reason not to, we offer 2 little pain pills before you actually go back for surgery. And that is one of the things that we do to help stop pain before it even gets started. And it's a great excuse to have the tiniest sip of water and wet your whistle a little bit. So the other thing that we'll talk to you about is regional anesthesia. And regional anesthesia is where we target nerves and inject local anesthetic around those nerves to help with pain. And that also stops pain before it even starts, or stops the transmission of pain after surgery. We talked about the oral medications. As you start to get better and progress in your rehab, we'll start weaning you off IV pain medications and maybe turning down some of that local anesthetic with the regional anesthetics and moving to pain pills. So lots of different approaches. All right. So often when you're coming to have a joint replaced, you've been in pain for a long time. And often people have been taking pain medications to control that pain because they've been putting the surgery off for a good while. This is what you'll see here, and this is just kind of something to be aware of. Your body kind of builds a tolerance to those pain medicines, and once you're kind of used to them, once you have an acute pain situation like a surgery, it can be a little bit harder to control your pain, and that's why we, again, offer that multimodal approach where we don't just use narcotic pain medicines. So I do have a little caveat regarding marijuana, because marijuana has been successful in controlling pain, chronic pain, and people are using it in that way. more and more studies are coming out, now that it's been legalized, at least in our state. And I will tell you anecdotally that people who use marijuana daily do have a harder time with acute pain. And it has to do with how pain is transmitted and those nerves. And sometimes those nerves that transmit pain actually become more sensitive to pain. So in an acute pain situation where you're having surgery, it can be harder to control your pain afterwards. So if you are using marijuana daily, it might be a good time to think about cutting back or minimizing that so that our medications do a better job for you when you get here. Because at this point, we don't have marijuana on our formulary yet.
And how about after surgery, could it be used for sleep only, not for pain?
After surgery,
I understand the
yeah.
concern.
After surgery, I guess I'm not going to go and tell you to use your marijuana, but if that's what you do to help you sleep, I don't have a major contraindication for it.
I haven't before, but
Yeah.
I've been told there are effective pills, THC pills, and I'm very concerned
Yeah.
about sleep after.
Afterwards, yeah. I understand that. And so, talk to your doctor about that.
Okay, no, thank you.
I can't really provide recommendations on that, but the important part for anybody to know if they're using marijuana daily, that you can have a little bit more pain in the acute setting. All right. So of course we do other things besides medication too, and I don't want you to underestimate or forget about some of these really simple things. Repositioning, elevation, ice. Those are just those old-fashioned remedies that really do work. Distraction, bring a good book. Sometimes friends and company or whatever can really help just distract you from the discomfort that unfortunately, may be present after a big surgery. All right, that's my piece.
Very good.
Any questions for me?
It wasn't painful at all.
Thank you.
Hello, my name is Tracy. I am a registered nurse on the medical surgical unit, and I'm going to cover two departments today, both case management and the medical surgical floor. So before you even come in for surgery, we are already planning for your discharge. You will get a pre-planning phone call, generally 2 weeks before your surgical date, from someone from the discharge planning or case management department. And they'll just start talking to you about some of the things that you have at your house and some ideas for rehab or planning for your post-care. They'll talk about equipment you might have. Some people have walkers or commodes already at home, so they'll make a list of some of the things you already have. And then they'll discuss some care options for you after surgery. Some of our patients will just stay in the hospital for 3 days and then are able to go home with family. Sometimes we set up home health or outpatient therapy, depending on preferences and mobility. We do have a swing bed program here at the hospital, which is an inpatient rehab. And then the other option is the longer-term skilled nursing facility. They will also discuss your financial needs for blood thinners. All orthopedic hips and knees will need some sort of blood thinner after surgery. If you're already on Coumadin, then you will go home back on your Coumadin dosing. For patients who do not take Coumadin on a regular basis, there are other options such as Lovenox and Xarelto, and different insurances cover the blood thinners in different ways. And so that's something that they will discuss with you during the phone call.
I've been kept in hospitals a few times longer till my INR got back in range.
Okay.
Would you keep me a few days? Do you keep people to the INRs correct again?
We usually use Lovenox as a bridge therapy.
Yes.
So that works instantly, or the day of the shot. Dr. Jonason will consult a medical doctor if you have a local primary care physician, or our hospitalist will cover your medical needs, and so that will be the physician's decision. Your local doctor will be the one responsible for restarting your Coumadin after surgery, which will be done here in the hospital, and then they'll decide whether you have to be therapeutic or not before you go home.
Yes, I understand.
Okay? We do ask that if you have advance directives, a living will, a DNR status, or a MOST form, that you bring them with you on the day of surgery. Legal requirements may require us to ask everybody for those forms if you have them. You will receive another phone call from discharge planning 2 to 3 days after discharge, and that's just kind of checking in with you, see if you have any questions, any worrisome symptoms, any side effects from medications, and they'll also help with insurance questions. Once you get up to the medical surgical floor, after surgery, you go pre-op, OR, and then to a recovery unit. Once you're awake, you'll come up to the second floor, the medical surgical room, and all of our rooms upstairs are private rooms. The length of stay is typically 1 to 4 days. 1 day is for total shoulders. They have a pretty quick turnaround time because there's not a lot of therapy we do immediately following. You have to keep that arm still for a while. But knees and hips are usually 2 to 3 days. We do provide 3 meals a day and a snack on request, and we request that you let us know if you have any special dietary restrictions or needs. If you're gluten-free, we can make accommodations. Anything special, let us know when you come in. Your team on medical surgical floor will be nurse, nursing assistant, your physician, physical therapy, occupational therapy, and then there's environmental services and dietaries. We have a great team to take care of you upstairs.
Will physical therapy have me walk the very first day? I had my knees done, and I was shocked.
Yes, yeah.
Will that be similar?
Yes, sir. If not walking, at least nursing can have you sitting on the side of the bed, dangling. It's all patient specific. So whatever you're up to doing, we try to avoid catheters, so most people have to get up to use the restroom the first night. So recovery head to toe. When you come upstairs, you're going to feel a little groggy, a little sedated. They've got some good drugs down in anesthesia. So a side effect is being forgetful. Another side effect is dry mouth. So we're going to ask that you not get out of bed without assistance. We want you to call, because when you come up to the floor, you're going to be tethered to all kinds of things. I've got this lovely sequential thing on. That's one of the things that's going to be tying you down. You're going to have oxygen in your nose. You're going to have an IV. So just want to make sure that nobody tries to get up by themselves. Chest and body. One of the things that we specialize in upstairs is preventing complications. So therapy is going to do rehab. We're going to control your pain. We also want to prevent post-op pneumonia. So you'll get a little device called an incentive spirometer, and we'll teach you breathing exercises, and we want you to do that 10 times every hour. We do want you to report any chest pain or shortness of breath right away, because those are not normal side effects. Something that you may likely feel is nausea because of the medications, especially pain medicines, can cause some nausea. And we want you to let us know right away, because we do have medicines to combat the nausea. Your nurse will assess you right after surgery, and we will progress your diet slowly. We'll start with just sips of water and ice chips, and throughout the day, we'll progress you to a regular diet. Bodily functions. It says you may have a urinary catheter, although we try to avoid it if possible. If you do have what we call a Foley, that usually comes out on day 1 or day 2 after surgery. We also are concerned with bowel movements. Being laid up in bed, taking narcotics, the whole situation of being in the hospital can make bowel movements difficult. So we do have some things we can do. Let your nurse know if you haven't had one after the first day. We can give you prune juice. You'll be getting a stool softener, and we can work our way up to laxatives if needed.
I know not to eat midnight the night before, but maybe eating very light the day before would help.
Right.
Help that.
Well, yeah, and we'll do everything we can to help
Sure.
restart your bowels.
Yeah.
Pain, Janelle talked a little bit about it. Up on the floor, we will have a picture of the pain scale in your room. 0, we say, is no pain whatsoever. 10 is the worst pain you can possibly imagine. We set a pain goal of what is tolerable for you. Pain is very patient specific. So like Janelle said, some people, can't tolerate a 1 or 2. Some people live at an 8 all the time. So we'll come up with a realistic pain goal for you, and we'll do everything we can to reach that pain goal. You'll be asked pretty much by everybody who comes in your room if you're having pain or not, and what number you would put on your pain. We do have several medications to work with. We have IV and oral forms. And then we're in the arms and legs section, so we'll talk about some of the other things that might be attached to you. Some of the patients come up with drains, not all. It's, again, patient-specific. I mentioned the SCDs, and these things will be wrapped around your legs, and they are to help prevent blood clots. There's a little balloon in here that inflates and deflates and helps with your circulation. Dressings. On post-op day number 2, occupational therapy usually does a shower with you. They remove your bulky post-op dressing and will apply a silver-based dressing. That dressing is good to stay on for up to 7 days, and we will also teach you we'll give you a spare one at home just in case it gets dirty or comes off, so that you could theoretically change it at home. And then we're going to encourage you to walk with staff. And that is the medical surgical portion of the presentation. Do you have any questions?
What, are there visitation hours, or can I tell people to just come from 7 to 9? Is it all day when people want?
It is all day, yes.
Okay.
Yeah. I believe the official hours are 8 to 8.
Great.
But we're pretty lenient on that. Just no parties at midnight.
Yes.
All right. Thank you.
Okay, thanks.
Hi, my name is Aaliyah, and I'm with occupational therapy.
I'm Sarah with physical therapy. You're a familiar face. Good to see you again. So we like to remind everybody that is interested in a total joint that even though we talk about all the little details, the reason that you're getting a total joint replaced in the first place is to get back to your goals, whether that's being able to walk without pain, ride a bike, dance, hold a grandbaby. So even though we hash out all of these little details, just remember the big picture in mind is to achieve your goal, get back to moving around without pain.
And while you're here, we are also going to help out with your discharge plans. So when you were talking about whether going home with home health or outpatient or whatever your plan is, we'll help with that. We're going to help with what equipment you might need when you go home. Lots of education on what you can and can't do and what you should avoid and things that you should be doing. And an exercise program, which is in your booklet.
And what to expect while you're here. Even though you did have surgery that day, you'll still start moving bright and early. And that's because we want to help you have the best outcome possible. And research shows the sooner patients get up and move after a total joint replacement, the less complications they have, like a blood clot, pneumonia. Those are all things that we're really trying to prevent. So you made the choice to have surgery, so you really have to buy into the idea that moving around is your friend. Even though it's a little sore at first, it does start to feel better, and it does really help your healing and progress. And with physical and occupational therapy, we usually try and see you the day of your surgery in the evening, and that doesn't mean that you have to get out of bed. Sometimes it's talking, helping you get more comfortable for the night. Sometimes it is getting up to the chair. It just depends on the person. We start to see you twice a day, and as you become more independent with moving around, you will transition to being seen once a day until you go home.
Now, you are going to have some precautions put in place, and these are only for about 4 to 6 weeks. And you said you're having a hip done?
Yes.
So depending on how he does the surgery and gives you a new hip, he'll tell you that you cannot do some certain things. One of them might be bending over to touch your feet. So we're going to help you on how to get yourself dressed and showing you different equipment that's going to help out with that. But these precautions, like I said, are temporary, so you don't have to worry about needing to do these forever, but they do help that new joint heal up very nicely.
And we like to talk about for total knees and total hips, the same idea applies. After surgery, we want to prevent and decrease swelling and increase your range of motion. We're not really working on strength for at least the first 2 weeks. So you have to keep in mind you're moving frequently, but for short bouts. We don't want you to sit in the chair longer than 20 to 30 minutes at a time, because when your foot is dangling down, gravity pulls the swelling down into your lower leg, and our goal is to prevent it from happening rather than have to deal with it once it happens. So moving around while you're here is important, but you have to keep in mind you are in the acute phase of healing, so adapt adapting your mobility is important.
We're going to show you a bunch of different things you should use too, one of which is the walker.
Here's a front wheel walker, and everybody with a total hip and total knee needs one of these. It's ideal if you come in with it. If you can borrow one from a friend or family, that's great. You can also purchase one or rent one if you needed to. The 2 wheels in front are really important, and the goal is that you can walk without a limp if you have a total knee or a total hip. So this helps you put weight through your hands and gives you a little more balance when you're walking. For a total shoulder replacement, sometimes people need a cane and sometimes people don't need anything, but we'll help you decide what you need when you come in.
Another piece of equipment that you might definitely need is a sock aid. Looks like this. Now, you said you've had surgery before, so no?
I'm familiar with them, but I haven't used them.
Okay, so you don't need to go out and buy one now. I'll use one with you while you're here and teach you how to use it, and then if you do want one when you go home, I'll show you where to get one.
And are they going to ask me to wear pressure stockings for a while or not?
Not necessarily.
Okay.
So, yeah, sometimes. Those aren't really for people that are up and moving around anymore.
Are there socks that I should get before surgery that are better than just Walmart cotton socks?
Walmart.
I know they have diabetic socks.
Has your doctor asked you to wear compression socks in the past?
No, but I did for my my knee replacement. I hated it. It really prevented sleep, as I remember.
Yeah,
They were
yeah.
just-
You know, we can tackle that when it comes, and per your doctor, if they really want you to have some compression on there, we'll figure it out,
And
but
these work for compression socks too.
not necessarily. These will work with your normal, regular cotton
right,
socks,
yeah.
yeah. And so if you do end up having to have something special on your feet or legs, we'll tackle that bridge when we come to it. Another piece of equipment that you might need to use is a reacher. Since you won't be bending at the hip for a while to help that heel up nice and tight, you're going to use this to be picking things up off the floor and also for lower body dressing, getting your underwear and pants on, and
Yes.
possibly taking your socks off. Okay? And as well as a bedside commode. So this can be used as a bedside commode if your bathroom is a long distance, but it can also be used as a toilet safety frame. So since you're not going to be allowed to bend over, you want handles on both sides of your toilet, and it has adjustable legs so you can make it higher. So, but we'll go over lots of different options. Do you have one like this at
I
home?
have one like that.
Okay, great.
And for each total joint, we have a specific exercise program made for total hips, shoulders, and knees, and they're all in the individual joint binders. And the goal with exercise, again, is that we're decreasing swelling and preventing swelling and increasing range of motion. And the exercise program is really important while you're here, and one of the goals with therapy is that you have that down before you leave and that you're able to do it by yourself. The other part of exercise I like to mention is that if you can maximize the strength of your joint, whether this applies to total hips and total knees, if you can get the muscles around that joint, even though it's sore, if you can get it stronger, the better your outcome ends up being. And some patients have a hard time doing that on their own, and it's okay to go see a physical therapist before surgery so you get an idea of what kind of exercises you can be doing now so you can maximize your recovery.
And at discharge, we're going to help with those therapy goals and the timeline, or how long. Some people are done in 2 to 3 days, and others need a little bit longer. Home health, so that would be maybe if you were to stay here on swing bed for a little bit longer, if you don't have someone at home to help, but we can figure that out when the time comes. Home health versus outpatient. I like it if, especially during the winter, you don't want to be getting out on the icy streets. You can have the therapist come to you. Sure. Instead of going to them. And then the follow-up phone call happens.
Usually a few months after surgery, we like to call you from our unknown number and see how everything is going, if you have achieved all of your goals and are happy with everything overall.
If I was entitled to a swing bed, stayed a few extra days, is it possible to just go home and not have to go to a physical therapy center?
Yeah.
Or is that required?
It's not required. Everyone has something different. So if we get to a certain point after your surgery and say it's probably going to take you at least 3 or 5 more days, then you could probably stay here on swing bed. If we're thinking, no, it's going to take you at least a month to get back to where you need to get in, maybe you have 5 stairs to get into your house, or maybe you have
I do.
a special circumstance. And so we'll practice that while you're here, and if it seems,
But I know physical therapy would like to tell you come 3 days a week for a month. But if you're motivated and really do the things at home,
yeah.
is it up to the patient to decide how often they want to go? Or is the doctor going to be strict and say, you've got to go 3 days a week?
You know,
Physical therapy, with outpatient physical therapy.
I'm deciding now who to
Yeah.
sign up with in town.
Sure.
Yeah.
And it is expensive.
It is expensive. And you know, with physical therapy, the reason it's so important after surgery is because, of course, you can go home and do your exercises by yourself. But the goal with physical therapy is that we do things that you can't do. So we have our hands on you,
Yes.
working on all of your swelling, helping you with sore muscles. Some people need a lot of hands-on to learn how to walk again. We ask you to forget everything you've known about walking, how you've been walking for the last 50 years or 20 years or 10 years since you've been in pain, and you have to start over again. So some patients need a little bit more coaching with that. So I feel like it's a fair request from a patient to say, you know, I'm really trying to make this affordable. Is it okay? Do you feel like my outcome is still going to be ideal if I come twice a week? And I feel like it's totally feasible to say, give me my exercises, I'll make sure, and we can tell if you don't do your exercises at home. If you're doing your exercises at home, it makes it way more feasible to come, you know, twice a week for the first 4 weeks and then taper from there, you know?
Once I'm discharged, do I have the option to come here for physical therapy, or would I have to go to another location?
The Heart of the Rockies clinic is on Highway 50.
That's right.
Yeah.
You guys only do inpatient.
Correct. Yep. And Salida is lucky we have probably 7 different physical
Yes.
therapy clinics in the area, and you can choose any of those you want. Oh, and it's important that you call when you know you're having surgery and your surgery's scheduled, because sometimes they have waiting lists. So we want to make sure that you get in. Ideally, you see a physical therapist no more than 2 days after going home. So if you went home on Friday, we want you to see your physical therapist on Monday. Does that make sense? Is that
And I'm scheduled on Tuesday, so
Perfect.
that wouldn't be a problem.
great? Sounds good.
Any other?
Questions?
Okay.
You're all set? Ready for round 2?
Yes.
All right, well, good luck with everything.
Yeah. Thank you for coming.